Om Swastiastu. Hello everyone, my name is Huliana Lim. I'm the representative of small group discussion B8 Udayana Medical School. In this occasion, we will going to present our student project with the given topic, Psychopathy.
Thank you for the opportunity. Now I would like to introduce myself. My name is Putra Pramanda. My three last name are 128. So now I would like to start this presentation about the background of psychopathy. As we know, mental health issues are serious matter that is being discussed in various countries. There are various mental health response in pandemic outbreak. For some people, misinformation can increase anxiety and various mental problems, one of which is antisocial personality disorder or ASPD. ASPD is mental disorder in which a person consistently behaves regardless of social responsibility and ignores the rights and feelings of others, and DSM-5 declared the diagnosis that ASPD is significantly associated with psychopathy. Psychopathy is neuropsychiatric disorder, and there are two underlying features, namely affective and interpersonal deficits and antisocial personality as lack of empathy, persistence of violence, of social norms, fearlessness, guilt, and remorse. Therefore, psychopathy is a serious disorder in the world and involves many studies. Violence caused largely by psychopathy forms a large part of society burden on public health and the criminal justice system. Knowing this, it becomes apparent that a further and better understanding of psychopathy can greatly benefit medical students, doctors, and other healthcare professionals to know and increase accuracy in dealing with this disorder. As such, this paper aims to explain psychopathy. That's all from me. This presentation will be continued by my friend. Thank you.
Hello everyone, my name is Natasya Pusparani with a 3-digit number of 227, and here I'm going to explain about our paper's problem formulation. First, what is the definition of psychopathy as a form of antisocial personality disorder, or ASPD? Second, how does psychopathy occur in a patient? Third, what symptoms are attributed to psychopathy to aid in its diagnosis? And fourth, what treatments or management are available for patients with psychopathy? Next is our paper's objectives and benefits. As for the objectives, the purpose of writing this literature review is to increase knowledge on psychopathy, especially for its definition and its treatments. Other aspects such as etiology, epidemiology, risk factors, symptoms, and differential diagnosis will also be covered in this paper. And then as for the benefits, there are several benefits to writing this paper applying for both parties, both the readers and the writers. And for the readers, this paper may serve to increase knowledge on psychopathy, especially on what symptoms to look out for and what treatments can be done. And as for the writers, knowledge is gained through reading journals and researching, as well as developing skills on how to work together in their designated teams.
Hello, my name is Azza with 3-digit student ID number 094. I will explain about psychopathy and why it's related with antisocial personality disorder or ASPD. ASPD is an unavoidable example of this record and for the infringements of the other's privilege. This issue should meet at least 3 of the accompanying diagnosis criteria as mentioned on the screen. ASPD is a personality disorder that cannot be diagnosed in childhood. An individual must be at least 18 years old of age and have been diagnosed by chronic disorder by 15 years to justify the diagnosis criteria. More than that, ASPD is related with coexisting mental health and addictive disorder, including sexual disorder, bipolar disorder, major depressive disorder, anxiety disorder, and significantly associated with psychopath. But an individual with ASPD is not necessarily a psychopath. In fact, data show only 1/3 of individuals with ASPD have the criteria of psychopath. Psychopathy itself is a psychological disorder that brings harm to society through its manipulative and callous behavior. Therefore, psychopath has been connected more with ASPD than with other personality disorder. The main diagnosis criteria of psychopathy contain 2 corresponding subfactors. The first one identified with harmful and egoistical utilization of other, and the second one is constantly unsound and antisocial way of life. Subfactor that is very closely associated with ASPD is the second subfactor.
Hello everybody, my name is Putu and my student identification number is 2002511084. So in this opportunity, I would like to explain the etiology of psychopath. Well, there is no universally accepted cause of psychopathy, there are basic biological patterns in brain dysfunction and environment factors that observe in individuals who display psychopathic tendencies. The majority of those who have grown to commit violent crimes have had histories of early childhood abuse or have at the very least been raised in environments where violence was the norm. The second etiology is the brain dysfunction. Frontal lobe dysfunction, specifically impairment on the orbital frontal cortex, along with the executive dysfunction that results, has long been linked to psychopathy. The psychopath present with symptoms similar to patient with orbitofrontal ventromedial lesions. So there is a possibility that psychopathy is caused by damage to this part of the brain. And the last etiology is the neurochemistry. Lower level of serotonin, epinephrine, and norepinephrine are identified in psychopath. Further, there is evidence that 2p12 area of chromosome 2 and variation within AVPR1A is the exact gene that causes psychopathy.
Hello everyone, my name is Ugrasena. My number is 20251184. So, in the general population, the prevalence of psychopathy is thought to be around 1%, but in prison rate it is raised to be 25%. The etiology of psychopathy is complicated with the contribution of both environmental risk factor and genetics and also correlations. Patients with GACO or juveniles who commit sexual offense have a high psychopathic nature with a prevalence of 13%. In forensic psychiatry, psychopathy is prevalent around 3% of total patients. So studies said antisocial personality disorder is found in 2 to 4% in men and 0.5 to 1% in women. The peak age of age prevalence of this personality was found at the age 24 to 44 years and decreased at the age of 45 to 64 years. Some research suggests that bad experience as well as traumatic experience in the childhood are very likely to result of choice that parents with ASPD may individual make, and this can trigger excessively delinquency of late children later on. So, psychopathy within the ACM cluster B personality disorder, particularly ASPD, narcissistic personality disorder, and borderline personality disorder. However, although psychopathy and ASPD are moderately correlated and both disorders include the pattern of antisocial behavior, they are different. The diagnosis of criteria for ASPD focus on severe and chronic pattern of this antisocial and criminal behavior. Studies showed that about 80 to 90% of individuals with a diagnosis of psychopathy will meet the criteria for the diagnosis of ASPD, whereas only about 25% of 40% for those with the diagnosis of ASPD will meet the criteria for psychopathy. So, conditions commonly comorbid with the psychopathy included substance use disorder and attention deficit or hyperactivity disorder, ADHD, which tend to be the most strongly related to antisocial feature of psychopathy. The concept of this psychopathy does not include anxiety problem as its central features.
Hello everyone, my name is Huliana Lim. My student ID number is 2002511080. Now, I will going to present about the risk factors of the psychopath. It is necessary to know what the factors influence a person to become a psychopath. There are two factors associated with psychopathy, the genetic and the environmental. Several studies have shown that there is an arrangement in the brain system that is influenced by the genetics. The structure and the functions of psychopath brain is different from the other normal people. These neural differences appear to be the result of upregulations of genes ZNF132 and RPL10B9 that encodes a protein in neurons. This is also affected by neurobiological change caused by the child interaction with their social environment during a crucial development period. Heredity is probably with the psychopaths also affecting. It seems from the data obtained that 3 out of 6 criminals are psychopaths have biological father who also psychopath. Psychosocial that increase psychopathic factors affected by family environment in childhood. This sent by the data that says 21% have a multi-generational history of problematic behavior as evidenced by a history of crime and crime affecting the child's life. Maltreatment has an early impact on psychopathic interpersonality characteristic. Toddler and young children also that have been physically abused are more aggressive toward distressed peers than their non-abused peers. Physical abuse is the stronger link between childhood maltreatment and adulthood psychopathy.
Hello everyone, my name is Angelyne Mulia with last three-digit number 051. So next I will explain about the diagnosis of psychopathy. Psychopathy is more common in people who grew up in a bad social environment, and it can occur since childhood or adolescence. The main features from these conditions are the usually lack of empathy, half manipulative behavior, and lack of remorse or guilt for what they have done. According to Hare Psychopathy Checklist Revised, there are two factors that can be used for diagnosing psychopathy. Those are factor 1 and factor 2. Factor 1, also known as primary psychopathy or interpersonal affective factor. This factor can be subdivided into two facets called interpersonal and affective. From the interpersonal facets, the psychopathic symptoms are glibness, a grandiose sense of self-worth, pathological lying, and manipulative behavior. And from the affective facets, the symptoms are shallow affect, lack of empathy, lack of remorse or guilt, and inability to accept responsibility for their own actions. Next is factor 2. Factor 2, also known as secondary psychopathy or chronic antisocial lifestyle. This factor also can be subdivided into two facets called lifestyles and antisocial. From the lifestyle facets, the psychopathic symptoms are irresponsibility and aggressions, impulsivity, lack of realistic long-term goals, and many others. And from the antisocial facets, the symptoms are poor behavior control, criminal versatility, juvenile delinquency, and many others. Besides that, there are also other behaviors that can be used for diagnosing psychopathy. Those are promiscuous sexual behavior and many short-term marital relationships.
My name is Gede Raka Samudra, number 023. Now I will explain to you about differential diagnosis of psychopath. One is sociopathy. The US Fifth Diagnostic Guide stated that the two cases, such as sociopath and psychopath, are classified as an antisocial personality disorder. Disobeying social policy, feeling innocence, and willing to do vicious behavior are the common points of those. 2. Narcissism. Narcissism is included in the dark traits as well as psychopathy and Machiavellianism that urges a character to fulfill the desire by way of dominating or exasperating for others. Narcissism is a personal trait that embedded deeply into belief of and requires some treatments. Narcissists divided into two subtypes such as grandiose narcissists and vulnerable narcissists. 3 is Machiavellianism. The distinction between Machiavellianism and psychopathy is that psychopathy refers to a wider range of immoral behavior beyond dishonesty. Machiavellianism shaping the chances into false and unethical behavior.
Hello everyone, my name is Gloria Grace with last three-digit number 162, and I'm going to continue the presentation. So another differential diagnosis are borderline personality disorder, categorized in the same B cluster personality disorder. BPD is apparent through instability pervasive pattern of interpersonal relationships, impulse control, self-image, and behavior. In one study, BPD traits are shown strongly related with factor 2 of psychopathy, which refers to impulsive behavior series, for example, irresponsibility. The next one is bipolar disorder. This is a repeated chronic disorder marked by temper and energy changes. The difference between bipolar disorder and other affective disorders is recurring manic or hypomanic episodes. Antisocial personality disorder has similar characteristics to bipolar disorder, namely impulsive behaviors, which often trigger law violation and suicidal behavior. The last one is sadism. Sadism is defined as pleasure obtained out of others' pain. The difference between sadism and psychopathy is the motive regarding the act of hurting others. According to one study, Psychopathy Checklist Revised result found that sadism is associated with factor 1 and factor 2 of psychopathy. So that's all from me. The next slide will be presented by my friend. Thank you.
Good afternoon, Doctor. Thank you for the opportunity. I'm Annisa Nuraini with the last three digits of NIM 110. I'd like to continue the presentation on pharmacological treatment in psychopathy. Here, we know that there has never been a specific psychopharmacological treatment for personality disorders, including psychopathy. The most significant problem here is impulsive aggression, which can be reduced by using anti-impulsive aggressive agents, or AIAAs. There are several types of AIAAs that are common to be used, which include lithium, the mood stabilizer, anticonvulsants defalproate, carbamazepine, and phenytoin. There are also side effects of AIAAs that should be considered before prescribing, because AIAAs could cause hepatic failure. It could also affect the fetal development in pregnant women and can also cause tremor. Lastly, recent studies in individuals with impulsive aggression showed a decrease of aggressiveness and impulsivity with the help of selective serotonin reuptake inhibitor, or SSRIs, fluoxetine, and quetiapine. But experts declared that there is still lack of evidence to promote this.
My name is Luh Wina Saraswati with the last three-digit NIM 142. I will present about non-pharmacological treatment. Treatment methods for patients with antisocial personality disorder or ASPD, including psychopath, have not been proven effective. Psychopathic patients have personality characteristics that have a major impact on the relationship between the therapist and the patient. According to experts, there are several potentially effective therapies, namely cognitive behavioral therapy or CBT, dialectical behavioral therapy or DBT, schema-focused therapy or SFT, person-centered psychotherapy, client-centered psychotherapy, psychodynamic psychotherapy, and mentalization-based treatment or MBT. In addition, there is also trauma care both individually and in groups. Experts say ASPD is treatable, but requires special care, a large investment in training, and the development of a treatment system. That's all from me. The presentation will be continued by my colleague. Thank you.
Good morning, after doctor. Let me introduce myself. My name is Felix with three-digit number is 099. I'm going to continue the presentation including chapter 3 of the conclusion. So, conclusion, psychopathy. Psychopathy is a personality disorder that brings harm to society through its manipulative and careless behavior. Individuals with psychopathy are usually characterized with antisocial personality, affective and interpersonal deficits. In general population, the prevalence of psychopathy are known to be 1%. However, in prisoners, the prevalence has raised until 25%. For psychopathy, there are no specific condition or etiology which can cause psychopathy. However, there are some factors that prompt or increase the risk of having psychopathy, such as genetic and environmental factors. Several studies have shown there are changes in psychopath brains due to genetics. In the environmental factors, harsh and violence surrounding in early individual childhood has influenced or giving a great impact of developing a psychiatric personality. So it has taken a very huge impact. For diagnosing psychopathy, there are two factors that are required for diagnosing, which are primary psychopathy and the secondary psychopathy. There are also the differential diagnosis that we need to differentiate between psychopathy and the other disorder, such as sociopathy, narcissism, machiavellism, personality borderline, bipolar, and sadism. For treating psychopathy, there are two ways. First of all, is the pharmacological treatment. The second is non-pharmacological treatment. In the pharmacological treatment, psychotropic medication has been always in the psychiatric disorder. However, for treating psychopathy, there are no type of specific medication that can be used. So the doctors always use the anti-impulsive aggressive agent. Anti-impulsive aggressive agent for treating psychopathy, for the dealing the impulsive aggression, which is one of the most problematic signs in psychopathy. In the non-pharmacological treatment, there is no difference in benefit between the non and the patient with psychopathy. So there must be a good type of factor, such as good relationship, Putu, and trust and acceptance on one of the other in the treating of non-pharmacological treatment. Next. So here are our references. Okay, before that, I'm going to close the session with Paramasanti. Om Santi 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 Om. Thank you for your time and your attention.